Okay, so hello everyone. For anyone who doesn't know, my name is Danny. I'm a third-year PhD student in bioengineering. I am co-advised by Professors Andrew McCulloch and Sam Ward. And today I'll be presenting on my work towards the development of a multi-scale model of shoulder injury risk in overhead throwing athletes. So to start, a little bit of an introduction. The CDC estimates that there are approximately 8.6 million sports injuries in the US per year, with about 3 million of those leading to ER visits annually. So though these types of injuries typically have low mortality rates, there are longer-term risks that are still associated, including risk of secondary injury or disease, injury recurrence, chronic pain, and cost of treatment being among them. So we know that there are risk of longer-term issues and a very large population of athletes in this country, but surprisingly little has been published looking at injury rates and types over the years, especially at the collegiate level. So because of this, I started working closely with our own athletics department to gain access to the past 10 years worth of injury data. So I presented a little bit on this before, but for anyone who doesn't know, we have 23 official collegiate sports here at UCSD, 12 men's teams and 11 women's teams, and we also have over 30 club teams. So there are a lot of student athletes on campus. Within our athletics department and the human performance space in general, people want to develop better ways of training, both to increase performance and to reduce the incidence of injury. And then when an injury does occur, we want to better be able to understand why and optimize the athlete's recovery, or better yet, we want to predict and prevent that injury in the first place. So obviously there's a lot of different teams to potentially collaborate with and a lot of different problems that athletics has that they personally want to solve. So to get a better idea of the key areas that should be further researched, we need to take a look at the actual data, which has not actually been done before. So here's just an overview of the incidence rate of injuries for each of the teams in the past 10 years. So you can see that there's a range of 0.5 to 2-ish for most of the sports. That means on average for the sport, an athlete will likely have between 1/2 and 2 injuries per season. So to me, that was pretty high for some of these sports. That means in sports like basketball, soccer, volleyball, an athlete is likely to get injured more than once per season. And this doesn't even take into account recurrences of the same injury. This is separate injury events. Then looking a little bit deeper into the actual breakdown of injuries between body areas, we can see that lower extremity injuries overall are the highest rate, with upper extremity being next. I personally play water polo recreationally, so I was drawn to look deeper into the more aquatic sports and eventually all of the overhead throwing sports, which, as we can see here, have a majority of upper extremity injuries. So looking deeper into those, we see that a majority of the upper extremity injuries are in the shoulder. And unfortunately, because of the way the data was taken, we can't look much more granularly at what type of shoulder injuries are actually seen because they haven't recorded that. And that is something that we are working with athletics to start recording in the future to get more detail on type of injuries overall. But even looking at sports that are traditionally considered overhead, the shoulder makes up for a pretty large percentage of the injuries seen. So it is definitely an area that needs to be focused on and looked more into. But because we don't have data that's more granular than this, I had to start looking more into the literature. So in the literature, we see that sports that involve repetitive overhead motion, such as baseball, softball, water polo, swimming, and football, are at especially high risk of upper extremity injuries, especially those involving the shoulder, which makes sense as the shoulder joint is the most complex joint in the human body, and it exhibits a pretty remarkable range of motion, allowing for more powerful and accurate throws. However, this increased mobility also renders the shoulder more susceptible to a variety of injuries. So the literature actually points to rotator cuff tears and labrum tears being the two most prevalent and devastating shoulder injuries for an athlete. Studies of the shoulder injuries have found that superior labrum, anterior to posterior, also known as SLAP lesions, have been identified in up to 26% of shoulder arthroscopies, and participation in overhead sports is the largest risk factor for this. There are a few papers that try to identify more specific risk factors, such as anatomy, throwing methods, that actually are risk factors for labral tears, but because there's very little research on the actual mechanism of injury, the only really widely agreed upon risk factor is overhead sport participation. So then a little bit more background on SLAP injuries specifically. The labrum itself is a fibrous cartilage lining in the glenoid cavity, which keeps the humerus in place and interacts with the hyaline articular cartilage, which surrounds it. The bicep muscle tendon attaches to the superior portion of the labrum to further stabilize the joint. And because of this, tears of the labrum can cause shoulder instability and pain. And once tears are formed, the low vascular supply in the labrum, along with the limited penetration depth of this blood supply, can lead areas of the labrum to be more susceptible to injury and impaired healing ability. So there are 4 different types of SLAP tears, with type 2 characterized by the bicep tendon detachment from the labrum being the most prevalent in throwing athletes. And mechanisms of SLAP tears can range from a single traumatic event or acute to repetitive microtraumatic injuries, chronic. And though there's some agreement that repetitive microtrauma is likely the cause of the majority, there has been very little research done on it because it is hard to replicate. So diagnosis of these tears can also be proved to be difficult because the symptoms such as pain, shoulder instability, and reduced mobility overlap with many other shoulder injuries, and small tears and microtraumatic injuries caused by repetitive actions may not present with symptoms severe enough to seek professional treatment. This leads to delay in treatment and potentially further tearing. Existing research on these tears has primarily focused on the treatment methods and repair techniques, so there really needs to be a further exploration on the actual mechanism of injury and preventative measures. Moreover, the literature that examines the actual mechanisms of injury in SLAP lesions focuses on acute tears rather than the more common microtraumatic injuries resulting from the repetitive actions that are seen in overhead throwing athletes. So given the persistent issues that are associated with SLAP lesions, it is very crucial to identify what risk factors are there and implement preventative strategies. So this will necessitate a deeper understanding of the mechanisms of injury in overhead throwing athletes and a determination of more quantifiable risk factors. And hopefully those findings can help determine or help inform coaches and trainers and healthcare professionals about the specific aspects of throwing technique, shoulder anatomy, that may contribute to labral stress and injury. So from there, I started thinking about what different scales I could be looking at. So to start, imaging, partial thickness, rotator cuff tears and SLAP tears were often seen in asymptomatic overhead throwing athletes, leading again us to think that micro trauma can lead to smaller tears that will lead to larger tears. Currently, the standard is MRI or MRA, which is just a contrast MR, but with contrast, it's very invasive, which is not something that most athletes would want to go through. And standard MRI techniques cannot successfully identify smaller tears. So that led to a discussion on the potential use of UTE to see smaller tears. And there's a group here at the VA that has actually done this before. They were able to quantify signal changes between normal, mild, and severe labral damage, specifically in T2 star and T1 row. So in the upcoming months, I will actually be working with this group at the VA to see what kind of signal changes we can see in degenerated labrums. We have some cadaver labrums that we will be imaging soon. The next scale is actual kinematics. There's very few papers, especially specifically in water polo, but there are studies that identify kinematic changes with fatigue, performance level, and between players, indicating that it could be significant in predicting injury, but they don't really move past that to actually identify the mechanism that would lead those factors to lead to higher risk of injury. Along with the imaging, we will also be doing labrum testing in the upcoming months, seeing how various signal changes in the MRI can be correlated perhaps with different mechanical properties of the labrum. And there have been a couple studies on this, but again, they have focused on acute methods of injury. So they have loaded until a tear occurs, as opposed to looking at how repetitive loading could perhaps affect the tissue. Some of the FEA models that have been published have all been on a single anatomy, so there haven't been any subject-specific models, and a lot of them don't include the soft tissue around the joint, which could be a large factor in the progression of tears. So just as a summary, what do we know and what is still missing at all of these scales? Where I started was the epidemiology project. Here we found that shoulder injuries overall are definitely a problem in overhead throwing athletes. And talking both to the athletes, the trainers, we see that these can cause lasting issues in both performance and pain, but we don't know, and nothing is published on the exact rates of specific types of shoulder injuries. And what we need for that is more sample sizes and different populations. And part of that is we will be working with other institutions and trying to both combine our past injury data and learn from what they are recording to improve our own injury taking metrics. Next, in the imaging and diagnosis methods, MR can be used to detect labrum tears, but not necessarily small ones. And when exactly should it be employed and acted upon? Maybe at the collegiate level, especially at an institution as large as ours, our athletes can be more preemptive and say, as soon as I start to feel pain, I'm going to get an MRI if the trainers think it's a good idea. But what about smaller institutions or at the high school level where maybe that pain is ignored for much longer until it's a more catastrophic tear? And we need a better understanding of the imaging presentation versus the clinical presentation, because there hasn't been anything published on preclinical labral tears and how that can present in the imaging. And then also seeing how morphological or biochemical changes in the athletes as they relate to things like training volume and anatomy, and how that can lead potentially to more risk of injury. Then in the rehabilitation and training methods, we know that exact return to sport plans are not really present at all in the literature on how effective they may be. And protocols may be based on the qualitative measure of athlete pain, but that isn't necessarily accurate. A lot of collegiate athletes will want to continue playing through the pain, or will just not have a good idea of how they can quantify their own risk based on their pain. So we need to find more standardized treatment methods based on quantitative measures versus qualitative measures. Next, looking at risk factors and prevention methods, I think that kinematic analysis and range of motion evaluations can currently point to some risk factors and identify methods of prevention, but we need to go more in depth on the actual risk factors themselves and how changing these may reduce or just generally affect injury rates. So for this, we need to be able to take more data, and that is what athletics wants us to help do. And then lastly, in the modeling side, the material properties of some labrums have been taken, but we don't really know how much this varies, especially within our population. A lot of these are done in cadavers of an older population, not necessarily an athlete population. And again, the FE models have been specifically made for those populations. So moving forward into more subject-specific models that are actually validated on athletes is necessary to get a better understanding of this. So that's kind of a summary of where I will be moving forward, and hopefully we're gonna get a lot of data in the next few months, but that's my thought process of the development of this project. So any questions?
Do you know, with like micro tear or like small tears that you're referring to? Do you know what like the cellular or ECM turnover rate is, right? Like, because there's a lot of work, I guess, on cadavers, but if you took let's say a mouse, if it has similar labrum structure, I don't know, that would probably present differently when you like tension it over and over again.
So there currently actually is no study that has, I actually looked for that, but there haven't been anything published on that specifically. And one of the main problems with the labrum is we are unique in that we are bipedal and we throw, there's not an animal model, a good animal model of the labrum itself. So we have to substitute with other ring-like cartilage structures like the meniscus in the knee, and things like that, but no animal can be used, I guess, as a model for the labrum, which makes a lot of these questions difficult, and why there's not really anything published on it.
I wonder if you looked at like orangutans or some monkeys that brachiate a lot, because that's kind of like a part of the throwing motion, and their geometry might be different, or their, not that that's like an expensive thing, but but if someone else did it, that would be interesting too. Yeah, no, it definitely would be, and I think, like you said, there's a lot of barriers to that actually getting done, being cost, space, the ethics of a lot of those questions, but yeah, it definitely would be interesting. Oh, and last question, for the small like fractures, I'll just, for lack of a better term, is there work done regarding fatigue? So like you cycle it and you get these like micro breaks, or is it like you guys just do a single pull test and see where it breaks? So everything published has been on a single pull test, but my goal is to do some fatigue testing on the cadaver shoulders that we have right now, and then hopefully develop an animal model. We're gonna again see how the meniscus and the knee can translate. But yeah, there hasn't been anything published on fatigue, and that is one avenue that we're starting soon, hopefully.
How does muscle growth or like physical therapy play into like preventative measures or rehabilitation?
So obviously, if the structures around the joint are more stabilized, you put less load on the labrum itself, so you're less likely to tear. So that is one thing that has more recently been implemented as a preventative measure, is preemptively strengthening the shoulder around it to prevent these tears. And then going into rehab, you can strengthen to help remove some of that laxity, which can be one of the causes of pain. The problem is, once the labrum tears to a certain point, it will not repair itself because of the low vascularity in cartilage itself. Usually doesn't repair itself. So you can help improve some of that, but if it gets to a certain point, surgery is kind of no option.
So there's like a point where you really can't like repair is it like the bone structure or the muscle itself?
So it's cartilage here.
Sort of like the in between of those two?
Right here is the most common tear, where this cartilage actually, it's cartilage attached to a different type of cartilage, but where these two detach. And that's one of the major stabilizing structures in your shoulder. So once it tears, there's a lot of shoulder laxity, which can lead to
Can
pain.
you visibly see when someone has that injury, like does their shoulder like hang or anything like that?
Well, in acute injuries, sometimes it's not, it can be caused by a subluxation, so a partial dislocation of the shoulder, and that can be seen. When it's caused by repetitive trauma, the trainers say that they can see the shoulder laxity increasing. It's not like a visible change, but they do tests where they can feel the difference in shoulder laxity. But there's no way to quantify it.
Can I ask a follow-up question about, you're saying that there are preventative strengthening exercises or something? Is that just like simple, like sort of strange exercises you might do to build your muscle, or are there other more sophisticated ways of strengthening the muscles around it?
I mean, that would be a question for the trainers. I imagine they each have like their own idea of what works best. There's no knowledge of what actually is the ideal method of preventing these tears and which structures need to be strengthened. But just, yeah, just standard shoulder exercises, depending on which muscles you want to strengthen.
I was wondering if you like stimulated the growth of these muscles or something, would that prevent it? If you had someone who had a lot of injuries or something, was getting near to one of these like, I don't know, turning point sort of injuries that you were gonna say, would it be like a treatment to give them some sort of stimulated muscle growth to try to prevent?
It's interesting, I haven't looked into anything like that.
Is the ultimate goal of this, like in my head, right? I am just surprised at how many sports have a significant amount of injuries associated with them. So, and obviously you want to maintain functionality as long as you can. And like, I think in the most ideal setting, it would be like you show up to practice and we do something like a simple test assessment to like assess risk, like on that day of. Because you don't want to prevent this, because it sounds like, yeah, once it's damaged like this, type 2 or type 3, you really, or you need surgery.
Yeah.
And so, I guess how can you like, is the goal for this to be assessed like preventatively at some point with the trainers or coaches who are leading these exercises that lead to this?
Yeah, that is my goal, and we're working closely with them to see what kind of things would be possible. One of the first steps in collaboration with them, hopefully, is to do a time series MR study to get a better understanding of progression and when clinical symptoms actually appear versus where damage can be seen in imaging, because that isn't known right now. So if that means that maybe in the future, athletes need to be getting regular imaging done, or like you said, relating it then to motion capabilities or strength in certain shoulder structures, just finding some quantitative tool of assessing that just doesn't exist right now. Yeah, so that's the goal, finding what quantitative tool can be most useful.
So it won't be like a simple, hey coach, I'm here, let's do a quick like push temple test. It'll be like
Probably
more
not.
invasive, like,
I mean, it shouldn't be invasive. The goal of working with this group is doing imaging that isn't invasive. So right now, to see smaller tears, it is invasive. But UTE has been shown to provide more quantitative detail in cartilage structures.
And then are there like examples of like individuals who are believed to have like the strength and size, you know, supporting muscles like right back, you know, shoulders, and then they still get tears?
There's nothing published. Everything right now on that end is more reports from the trainers and things like that. So I personally actually have a labrum tear. I never got surgery. I don't play professionally, so I don't really need the like increased function that I would get back from surgery. But it took about 2.5 years from the initial injury to like actual diagnosis. And it definitely progressed during that time. And their goal is to find tools that allow us to get that diagnosis earlier, and then eventually again, identify risk factors earlier to prevent them in the first place.
My name is Will. I'm a third-year PhD student. I am co-advised by Sylvia Herbert, who's in the mechanical engineering department, and Garrett Kauenbergs, who is in bio-E department. Most of my work now looks pretty mathy, like you'll see in my talk today. But if you bear with me, I will present it to you without trying to be too technical. And it's generally towards trying to do some sort of high dimensional nonlinear model. Yeah.
You want to share your screen?
Oh, yeah, so sorry.
That's right.
I'm not even in the same call.
Sweet. Okay, so again, my name is Will, if I haven't had a chance to meet you. I'm co-advised by Sylvia and Gert, who make a fantastic team. And I do a lot of math for modeling, essentially, particularly for modeling and control. Sylvia's group is a robotics group for the most part. And so a lot of the math that I'll present to you today has an intention for them to be deployed on some sort of autonomous device. But these same sort of issues come up in most high-dimensional nonlinear models, which is what led me here. So there are lots of multi-scale models. The common theme, as you might be immediately faced with.
Yeah, it works, thanks.
Is that okay, Dr. Rangamani?
Works. You can hear me?
Okay, well, just let me know.
Okay, thanks.
Yes, so multi-scale models are a great way to try to accurately capture very complicated processes, but generally they become very hairy fast. You all are probably familiar with this to some degree if you're in this room today, but particularly the aspect I'm going to talk about that causes issues is that these models are high dimensional. So if you were to take each of these pieces and you stick them into one long list and you try to model the whole thing at once, that is akin to adding many more dimensions to your model. And high dimensional models are notorious because they're generally slower, but they're also trickier when it comes to solving certain types of robustness. So of course, we can do all of these crazy sort of mix and match models. But the problem is you want to do this in a way such that you're robust to error. And that is generally harder in high dimension and has propelled my work up to this point. And I'll talk about some directions for that today. So again, these models, because they're often so complex, can include error, and sometimes that can make your matter worse than even a simple model. The question is, how can we make them robust? So before we get there, I want to get on the same page about some words that I'll probably use over and over, and you might have a slightly different definition for, but when I say system today, I mean a group of things that change one another over time. So I'm talking about a temporal process, and this can be either naturally or by design. A dimension here is the number of things. So if you're modeling, cells in conjunction with stress and strain, that would be a dimension for each cell type maybe, and stress and strain, for example, and you can go forward and so forth. The state of the model is a specific quantity of each thing that you're concerned with. And the state space is all of the types or all of the different combinations of these quantities. Moreover, we assume in most cases that you have generally some sort of way to manipulate this system, which we call control. And this is external to your system. Additionally, there's something which we will call disturbance, which actually vaguely represents an external influence that you do not control. And so that is useful for modeling stochasticity in general. The error of your model, because your model might not be random, but your model might be wrong in some way that you don't know. And additionally, if there's an opponent in your model, you can think of this being as literally an antagonistic fighter pilot that you're modeling in a pursuit evasion game, or it can be something like virulence in an SIR model. But the point is if you have some sort of disturbance, you can then create robustness to disturbance. That's what we'll try to do today. And finally, the model word here, I mean as a specific mathematical or set of mathematical equations, which you're going to use to try to predict your system's evolution with controller disturbance. And so in the notation today, starting from the bottom maybe and working our way up, you have some sort of equation here which describes your model. This system, again, is a set of things over time. And so we use dx dt as in a representation for the derivative of each of your elements. N is a dimension and x is this state. And so x is a vector generally, or at least I'll assume so to say, where you have a quantity of each thing. You could think of it as cell population, stress, strain, so the control is represented by a variable u and the disturbance by a variable d. And so now here at the bottom, you can understand we now have some sort of equation, which is a set of functions which describes our evolution over time. Also, at any point, feel free to interrupt me if you have any questions, if I'm unclear. I probably have some errors. To give you an example to color this, so imagine you have two cellular populations you're trying to model in some sort of environment. The dimension here is 2, and the state here is the quantity of each population. So here, the state is both quantities, is the important part, it's the vector. And here I counted 25 red cells and 19 blue cells, and that's the whole state of your system in this setting. And of course, we can represent that in a planar space here, where you have x1 and x2, and of course, our state now is one point in this space. And this greater space is our state space. So the point is this will evolve over time now, because we know the populations affect one another. And we also might have some sort of control or disturbance. So the control here could be the addition of glucose per second, or similarly a drug. And the disturbance could be measurement error from some sort of device, or a third unknown population, which is influencing the dynamics in an unknown way. The point is this vector over time will give us a prediction of what's going to happen to our state. A model that you might choose here is the Volterra, for example, which is an 100-year-old population model, which says that the change in time of species 1 is dependent on some parameters, alpha 1, beta 1, and the relative sizes at the existing states of your two populations. And then you have some sort of control disturbance. And so you'll see these sorts of pictures today, or as drawings. And what I mean here is that this is where the system is going to go over time. And in this example, we mean that the population, the relative populations of these two cells will move to some new different combination in time, which we perhaps like to control. So now with this example, I'd like to introduce a couple more concepts. One being a trajectory, which you can now just think of as the path of some sort of states over time, which depend on where you start and perhaps what sort of controls or disturbances were added along the way. This is represented by a variable gamma. In this example, this is the change in the relative sizes of the population. So the Volterra model famously cycles because it's a predator-prey model. So you see the predators go up when you have you see prey go up, they get really healthy, then the predators eat all the prey drops, and then the predators drop because they have nothing to eat. And you see the cycle happen again. And so you see this oscillation in the state space. So you see they're sort of equal, one's greater, they're equal but lower, and then you see the growth of the prey here. These might not actually be eating one another, but they might have this sort of abstract relationship where their presence influences both positively or negatively the other species' presence. I will now introduce a target, and by target, I mean a region of your state space which is relevant to you for some reason. Perhaps in this example, it's because you know that when you reach a certain relative set of populations between the two cells, you have some sort of phenotype. So it could be healthy or it could be disease state. The choice of actually wanting to be in this target or wanting to avoid the target is actually mathematically identical. We call these reach or avoid games. And the point is now is if I have some target, I have some system that evolves over time, I want to know the states which are going to arrive at the target. So this is relevant because I want to know about the populations which might ultimately become this healthy population because it's going to boost my immune system or something, or because it's going to make me sick. And so I want to know about the states ahead of time which will get there. And specifically, we want to know about the states which will get there in some sense, despite any disturbance for some control. And that's called the reach set. And you have analogously this set of states which will reach the target despite any control I take for some disturbances. So what I mean, to be clear, is that I want to know about the states where I can, in the reach case, for example, where I can insert some sort of control. And no matter what disturbance happens in my model, error, stochasticity, antagonist, I will arrive at the target safely. So this is a sort of safety analysis, it's called. And the point is it will make us robust. And similarly, in the avoid case, we want to know about some states where no matter what control we apply to the system, we will be driven into the target which we seek to avoid. And therefore, these states are dangerous. So you might wonder now how you can solve such a set. It's seemingly impressive. The way it's formalized is by assuming the disturbance is actually an opponent in a game that you're playing. And so the point is, if you assume your disturbance is acting for against whatever goal you have, whether that's to reach or avoid this target, then you can come up with the states where you will win or lose to such a disturbance. And this is formalized in the following way. To go over this again, we have assumed we have some sort of dynamics. And so they look like this. These are different trajectories for different initial conditions, for different controls or disturbances, perhaps, in some sort of state space. What we can do now is we can formalize our desire to be in the target or not be in the target by defining a cost function. And this cost function will simply penalize whether I am in the target or out of the target at the end of the trajectory. So this is represented by a function j here, which specifically has these qualities such that j of a state is less than 0 if the state is in the target, or j of x is greater than 0 if x is outside the target. And then you have this nice property, of course, that your cost will be less than 0 if and only if the state you're at will ultimately be within the target. The next thing that you have to do in order to design this game is now you're going to say, all right, I can maybe be in this target for some sort of controls or disturbances. I need to consider all the controls and all the disturbances, and I want to say that they're playing against each other. So if my goal here is to minimize the distance to a target because I want to reach it, then I will assume my disturbance chooses to maximize this distance. And similarly, you can flip the min and the max for the avoid game, where I'm trying to maximize my disturbance to a target and my disturbance is trying to minimize it. And you can ignore these variables here, but if you are interested, they mean the set of all controls possibly over time. And here, actually, this funny variable represents the set of disturbance strategies, which is technically a different mathematical object. The nice part about this value function, though, here is that if we solve this value function, it will have this property such that the value of a state at a time being less than or equal to 0 means that this state is in that set we described earlier, the quote unquote reach or avoid set, which we'd like to solve. So what that means essentially is that the 0 level set of this value function describes our reachable set. It is, in a sense, encoded in this value function. And so it remains to solve this value function. It turns out, as someone worked out now seemingly 40 years ago, that this value function is also the solution of a partial differential equation, which is abstract. It was a very significant finding at the time and still guides lots of work today. I could not ever tell you exactly how that proof works. But the point is is that we can solve this abstract PDE. Many of you are probably familiar with solving PDEs here in order to get this value function. And that's really nice, because solving a PDE in some sense is easy, right? You've probably done it, you've gridded up a space or something, and you have some sort of equation describing how the value at any point in space will evolve in time based on its neighbors' points in space. Here, this is called a Hamilton-Jacobi PDE, which is something from physics that's older even than the work I'm presenting today, or this result by another 50 years. And it depends on something called this function called a Hamiltonian here, which is abstract, and I wouldn't try to offer intuition towards, except you can note that it incorporates the dynamics. This argument, which is called a costate, but is abstract, and we are taking the minimum and the maximum at any point over this costate producted with the dynamics. And the point is if your value function is initialized with that level set function, which parameterizes the target, then the PDE over time will give you the value function. I know that's a lot. So here in pictures, you have some target, which is relevant to you for a variety of reasons. You define this level set function called an initial function, j of x here. So here, this is in 2 dimensions now. We're talking about the plane here, and the value is defined as the 3rd dimension. And so the point is the 0 level set of the target is the set of reachable states immediately. And so all these states inside the target here have a value lesser than 0, and all these states outside the target have a value greater than 0 and are therefore unsafe and unreachable immediately. And then you solve a PDE, which expands from this value function over time by gridding over space. The evolution of the PDE is dependent on that Hamiltonian, which is a function of your dynamics and this game between your control and your disturbance. It is not easy to predict, famously. And that's continuously demonstrated by machine learning methods and so forth today. It is elegant, and ultimately the point is that we have this 0 level set now, which describes our reachable set at any time, which is great. And moreover, you can actually design, you can go back and find the optimal control that you need to take in order to reach this target or to avoid this target. And this will be guaranteed to work against the disturbance bounds you assumed before. So this is all really nice. You can even get crazier. So this is now an avoiding target. So you need to avoid that, and you also want to reach the green target. It's a very general, powerful framework, and this can be applied to any set of dynamics, any nonlinear dynamics. The problem, though, is the dimensionality. Which, as I explained to you initially, is perhaps the one common thread in multi-scale models. So this is ultimately solving a PDE, which, as you may have done before, involves gridding up a space, generally in a numerical procedure. And so if you're gridding up a space, if you need to grid each dimension, you can now see that the number of points you have in your grid will grow exponentially. This is often called the curse of dimensionality. And what it means is that the compute power needs to grow exponentially in order to solve your problem. And so in practice, using these methods for systems of dimension greater than 6 is infeasible, offline, with a server, anything. You can imagine that most models that we'd like to apply this to for the sake of robustness are greater than 6 dimensions. And so we'd like to extend these methods to higher dimensions. And that has been basically my work. At a high level, it works like this. So more recently, in the last 7 years, someone worked out that a solution to this PDE, which therefore doesn't require time-stepping numerical solutions, is given for a very specific set of dynamics, particularly linear dynamics, and you have some more technical assumptions. But we would like to apply these safely, and we would like to solve nonlinear systems, which are high-dimensional, as most biological models and many complicated models in general are nonlinear. And so I have tried to pair this with some sort of safe and accurate linearization method in order to rapidly get a conservative estimate. of our reachable set and therefore derive a controller, which is conservative as well. This itself is the Hop formula, which is actually an optimization problem, and is worth more than one talk of itself. The main point here is that in order to apply this formula for the value function, you need your dynamics on this left side to be linear. And so this function f of x, which describes your dynamics, must be linear, which is a pretty limiting constraint. But if they are, then you can use this crazy fundamental matrix map, it's called, to move your system into a state independent system. And here the Hop formula is applicable. And this was recognized in 2016, basically, 2017. So with a linear system, you can keep expanding dimension. This is a graph showing how long it takes to solve the value at any point in time in seconds per dimension. This is honestly old. There are newer works showing that you can move up to dimension 4,000. And the point here is that we have a nice fast way basically to solve linear solutions where we can derive robust solutions and robust controllers for these linear systems, but they must be linear. And so we'd like to generalize this in some way to nonlinear systems. What this requires is making a safe linearization. And so linearizations themselves are an old concept. You've definitely done them before. The point is you need to do it in a way such that you can preserve the guarantees of your reachable set. And that is a little more complicated, but the trick is first to recognize that there is this feasible set of all states which could reach your target for any controller disturbance, not respective to the game. And only upon this bounded set, actually, do you need to worry about your reachable problem. And so on this bounded set, you can take any linear model here presented at the top, and you can, with some error, represent your true nonlinear dynamics. And so the point here is that f for any state in this green set can be written as a linear model plus a bounded error. And that's basically the main key. From there, we're going to do something maybe a little stranger, which is that what you should then do is actually define another player in your game, which we call an antagonistic error player, but is essentially a different player that may take actions which are of the same size as the error. And so the point is now if I am considering a game against an opponent who can play the error in some sense, where I can beat this opponent is also where I can survive according to the true error of the system, since it is one of their strategies. So more formally, you define a value function, which is the same as before, except now we have added another player against us who is playing errors. And so the point is now we may take trajectories in our linear model, which do not correspond to our true dynamics, but one of those error trajectories does. And so long as we are robust to all of them, we will be robust to that one as well. So the idea for the proof basically works that you can change any two trajectories of your nonlinear system into a linear trajectory with error. And if you consider the maximum over all errors and the true error was within that set of error strategies, then you get conservative guarantees of your reachable set, denoted by the blue set inside the purple set. The point is we don't know where the purple set is because we can't solve it in high dimensions, but we can know that the blue set is inside of it, wherever it is. And of course, they're both within the green set, so long as you use this game with antagonistic error, quote unquote. In English, again, this is basically works by saying that if the antagonistic error can induce the true trajectory of your system, then of course, if we can beat this antagonistic error and its best strategy, then we can also beat the true error. So this is an example in a small system called the Van der Pol system, which is often used to model action potentials. And here, this is a real solution. So here in blue, you actually have the feasible set, black is some reachable target. Gold here is your true reachable set, which we can solve because the system is two-dimensional. And green is the fast conservative solution. And so you can see in the reach case, we get an inner approximation, which is safe. So we know that all of these states will be within the true reachable set. We just lose some here because of the conservativeness. And similarly, in the avoid game, you get an outer protective shell. So you say that now all of these states I know, some of them are truly unavoidable, and we just have an over approximation of it safely. So this is nice and it works. The only issue is you can see that there is over conservativeness here, and it gets worse over time. So the point is if I need to reject all possible errors between any system, I actually need to be a lot stronger than I do if I just need to reject one true error. And so in the work, we actually devised several more ways of improving this by giving a time varying error. You can do some more technical things like defining a disturbance only error, which is valid and offers even tighter approximations here in the pink. And then you can also, because you have a guarantee for any one linear model, you can now use an ensemble of linear models and take their union or intersection in the region avoid games. And similarly, you can split up your target into smaller targets, and you can come up with what's called a partition solution in both the reach and avoid sets, where here the union of your partitions will be an under approximation, and the intersection of your avoid over approximations will be a conservative over approximation. We went forward and demonstrated this in a 15-dimensional model, which is a pursuit evasion game. So you imagine that there are 5 agents which are trying to collide with you, and you would like to compute some sort of evasive policy rapidly. If you were to use feasible sets alone, which I might have failed to mention, but are actually rapid to solve or over approximate, you would have a very conservative estimate of your game. And you would basically have to assume that you're unsafe most of the times because one of these 5 agents may feasibly catch you. And instead, we show that you can actually devise evasive policies with this method, which are safe and guaranteed in the rollout. And we chose this model because it's a standard in the literature. And so it was a nice way to present to people. But more recently, I submitted a work which extends this towards lifted systems. So if you have a linearization, which is based off of some sort of lifting function, which may increase the error, it becomes more complicated, but you can apply this along with some other results. And this is nice because your linearizations are ultimately better. And so that conservative guarantee is a lot better in higher dimensional models. And that is generally all I can talk about today with our time limits. We have some future directions. If you're curious, please come ask me about them. The work I presented on today was this conservative linear envelopes work. And of course, all the code I had to make these plots is available in a package on GitHub if you're curious. Thanks for listening. This is my group. They're great. Sweet.
Can you go a few slides back? I can't remember exactly which one it is. This one, or yeah, the next one, that one. So the difference between the gold and the green spaces, how does that affect the results of your system, or like the results that you're getting?
So the gold states here are all the states which we know can actually reach the target. And so we would like to know about as many of them as possible. Of course, if your system is very nonlinear, though, your conservative estimate, which must be robust to all errors, is going to be much smaller. So this green set is the set of states which are not only reachable to the target truly, but they're also robust to an error which can actually play even beyond your true nonlinear dynamics. And so what I'm trying to say is basically, if you have a really nonlinear model, or you have some long horizon, which allows this error to play more, you can expect an increased gap between these two. And that's undesirable because we want to consider all the states. And in fact, actually, if your error is going to keep increasing for any increased feasible set, then you can expect this inner approximation to ultimately vanish. And so you would like ultimately to improve these methods by making them robust with some of the more technical methods I said afterwards, or by having more accurate linear models.
So then, is there like an acceptable gap that you're working with, or is there an additional model to make that acceptable?
Yeah, so it depends on the context. If you have really any inner approximation, that's good generally, because that means there are some safe states which you can use to arrive at your target of interest. But for a lot of time horizons, they vanish. And so, and that again is dependent on the system. This also depends on how much disturbance you have and how much control you have. And so this motivated this later work where you have more complicated linear models here by doing this quote unquote lifting, which is also known as Koopman approximation, if you've ever heard that term. But in order to do this more complicated linear approximation, you need a more complicated method. And so we did seek it out, and it's been done now, but it took some time.
How far out in space or time can you go? This is case by case with your linear approximation. Are you limited to like very?
This is a good question. Yeah, so in that two-dimensional Van der Pol case, it ends up being, if you don't add any of these add-ons, you have an upper limit of like 1 to 2 seconds, which could be fine for an application, could be, you know, the end of the story for some applications. With these, you certainly get improvements. So I think with the best one here on the right, on the upper right, it was something like 5 seconds. But it is certainly going to vanish at some point in time. And this also depends on where in your state space you are, because you can imagine there's different nonlinearities across your state space. And so when the nonlinearity is bigger and greater from your linear model, you have a worse guarantee there. But yeah, so this kind of comes down to the time scale of your model as well. It seems to be across the models I've tried that you get like 1 to 2 seconds on its own. You might be able to improve that. Some situations you get less though, some situations you get more. And the question is whether or not that's available for you. It's certainly an open area of development.
Of course. Yeah. So was it the cost optimization that was a solution to a partial differential equation?
Yes, it's this optimal value. Well, yeah, it's probably easiest to show here. So the cost here is there's really, you can kind of say 2 costs. So the cost is what we give to any trajectory of our system, and it's only dependent on where the trajectory ends. What we now want to say is what's the optimal cost. And so, yes, the optimization of that cost is the solution to the PDE.
What PDE is that?
It's this PDE here. So the PDE is described with a boundary condition, which is that J function here, and you actually integrate it backwards in time. And so the evolution of that value function, the PDE over space, is given by the Hamiltonian. It's traditionally written in that way, but you can basically see that it means dv dt is equal to negative h for any point in space. And that h is given by this thing called a Hamiltonian, which comes from physics. But then the point is that you start with this and you integrate back in time, and this is the solution of your PDE over time.
The Hamiltonian is like an energy function.
Exactly, that's actually what it comes from. So here, because we have control and disturbance, we're no longer assuming a conservation of energy, but it still takes the same form, which is why it's called Hamiltonian. But yeah, originally Hamiltonians in lots of branches of physics, as Nate will probably tell you more easily, have a constant value. So you assume that you have some sort of constant energy or something.
I took physics as my undergrad, so like I guess like harmonic oscillator,
Yeah.
kind of like contrast to Lagrange coordinates, like
Yeah.
Lagrangians, like sort of I guess like using like position and momentum, so it's kind of like I guess like it's sort of like a transport, like it is a transport
Yes.
problem.
Yes, it is a transport problem.
Does it connect to the Fokker-Planck equation?
I know what this is, but not enough to say whether there are significant connections. I have seen transport solutions for Hamilton Jacobi PDEs, which often involve something called mean field games, which are even more complicated, but assume basically that you have a discretization of like quanta or something over space, and that you assume that each one is basically an agent solving a game for itself, and then you can solve how they'll optimally transport, basically. But yeah, that's more complicated.
What's called mean field game.
Mean field games. They're very interesting, but yeah, they take a lot of mathematical definition before you can start talking about the solutions. So there is a hot formula for linear mean field games though. And people use that to solve like fluid flows and try to predict turbulence, particularly in those crazy fluid models. Where there you have no control, but you'd like to have a disturbance to know a conservative prediction of your fluid.
Thank you.
And of course. Sweet. Well, if you have any more questions, feel free to reach out to me. Thank you for listening.
Thank you.